My name is Ayden Prehara. I'm a senior at Madison West High School. I am part of the PATCH program. I'm a teen educator and this is my second year. So as a teen educator, our job is to go out and we have two different workshops that we do. One of them is going and talking to our fellow teens, our peers, about their rights in a doctor's office and how to make that a comfortable environment and getting them to know their rights. The second workshop we do is for other doctors and healthcare providers, and that's all about making a safe and welcoming environment for teens, helping them understand how teens understand the doctor's office, making sure they understand confidentiality and all those kind of things. At least in the panel settings that I'm in, that's the only way I've interacted with doctors, but the questions I normally get are about gender identity and sexuality and how to make those come across, because in the workshops that I do, I'm very open about the fact that I am trans and I am queer identified. So a lot of what I get is how do I bring up these conversations? How can I ask this respectfully? I generally find doctors are very receptive to that and they really want to make a comfortable environment for their patients, but they don't know how to do it because they've never had that one-on-one conversation. With med students, they always tell us this is the only time we're going to be able to talk to students or be able to talk to youth. That's just not part of their training in med school. Students are just kind of what do you mean that I can change my doctor? What do you mean that I have confidentiality? How can I talk to this? How can I get my parent out of the room? I think those really small things that can make a doctor's office appointment so much more comfortable that people just don't know how to do. So last year, it was my first workshop ever, and it was at my high school actually during the freshman health classes. All freshmen are required to go through them, and it was a day, I think we had 5 presentations in one day, so it was a lot of talking. And it went really well. People seemed to like what we were saying. They were into the activities, they were participating. But it wasn't until a few months later that a student came up. I was wearing my PATCH shirt in the hallway, and he was like, you're in the PATCH program, right? I was like, yeah. He was like, you did the presentations, right? I was like, yeah. And he said to me, he was like, thank you guys so much for doing this. As soon as you guys left, I pretty much called up my doctor and we had an amazing conversation. For the first time, I've had this doctor my entire life, but finally I was able to talk to him about things that I needed to talk to him about. And I think that was really incredible because it wasn't just a right away people liked what they were hearing. It was people a few months later, the information that we gave them was sticking with them. It wasn't just kind of a short-term thing. It was very long-term, and he was very grateful about it. He has stopped me multiple times in the hallway to tell me his experiences, and I think that's really, really powerful. Like I said earlier, it's the little things that really make a doctor's office comfortable and welcoming and able to get the healthcare that you need that people don't understand or have never been taught. So I think that when the PATCH program goes into these environments of all youth and tell them hey, you can get a new doctor if this one doesn't make you comfortable. You can have confidentiality. That is your legal right. It's those things that it's making healthcare something that youth can get and make them comfortable getting, because everyone knows doctor's offices are not the most comfortable place to be, and any little step forward, that's going to make a whole so much healthier generation.